My name's Robert Moots, and I'm Professor of Rheumatology and Consultant Rheumatologist based in Liverpool in the United Kingdom. I originally decided to become a doctor many years ago, although maybe not that long ago, because I wanted to help people and I enjoyed science. And I chose rheumatology because this is a specialty that allows me to see patients for long periods of time, to get to know them, to understand where they're coming from, and importantly, because science underlying rheumatology has grown dramatically over the years. So it's a really exciting opportunity to do research and translate the research findings in a lab into better care for patients. I grew up around the northwest of England, but then I trained in London, worked in Oxford, and then moved across to America to work at Harvard. So I've worked in a number of countries, and actually I spend a lot of time, as much as I can, in Africa, where we're helping develop rheumatology in those areas. It's hard to say what's the most rewarding thing about my job, because I enjoy everything. I think there's three things that I would probably highlight. One is interacting with people. It's really good to see people, to hear from people, and I hope to help people. Number two, it's important to try and develop the science so we understand more about disease and therefore develop treatments to be even better. And then the third thing, equally importantly, is to use this knowledge to help people in other parts of the world, particularly in sub-Saharan Africa, where there's very little rheumatology and where we're doing a lot of work to try and help develop care in that area. It's hard to know what I could say if you were to ask me what patients value most about me. I think you should really ask the patients about that. But it's easy to say what I value about patients, and that's be able to take part in people's lives, to hear what's going on, to hear what the problems are, to hear all the hopes and fears, and to be able to help them with a disease that's blocking them living the life in the way they want to. There are many challenges in my specialty. We look after people with chronic disease. Although we sometimes can cure people, it's not as often as we would want. But that's not a big deal because we can control disease. It might be people need treatments, but with treatments, they can have a normal life. I don't think there's any particular mantra or catchphrase that I tend to use in my work, apart from I just want to try and do my best. That sounds a bit crazy, but that's the truth. And when I'm working, I'm often find myself in frustrating or stressful or difficult situations. And that's often because it's sometimes difficult to understand where a patient's coming from. But I find that if I can just be patient and be a listener and let the patient tell me what's going on, we can always resolve a difficult situation. How would I describe my profession? Well, I could think of some funny words, but I think really I'd like to hope that it would be caring, that it would be listening, and that it would be doing, and that all of those things can help drive patient care better.